it's about leading care with compassion and making sure that the way that we communicate and talk to and deliver our care is actually hitting what that person needs. So, you know, what my mum would love to do is to have a chat. What my dad would want to do is to just get out of there as quickly as possible. And so kindness is about actually understanding what they want and delivering it in that way. It's also about kindness to each other, caring for each other, asking genuinely how people are, and if people are looking not so good, you know, taking some time to be present and hear and listen to what it is that is troubling them. And that's not just patients and families, it's about our colleagues, you know, it's about listening to them in a way that means that you actually do care. So it's about being very compassionate and very present and focused on their individual needs.
My approach to kindness is because I'm interested in the origin of words. I look at the word kindness and where does it come from? And it comes from an Old English term that means kin, which means kinship. And so what kindness means is that we treat people as though they're members of the family. We cooperate, we think in terms of empathy and sympathy. And so a kindness approach to healthcare is like treating people as though they're part of your family, like loved ones.
I think kindness in healthcare really relates to making connection with the person. So relating to the patient or the client you're seeing by making eye contact and a really, really simple gesture of a hand on a shoulder, a hand on an arm, just so you've got a bit of connectedness and that person feels and you feel too that you have a really good connection and you can express your kindness through that really simple process.
Kindness in healthcare to me means looking after each other and looking out for one another.
Well, to me, kindness in healthcare is what the word means, being kind. So whether that is for patients, anybody that walks in off the street, if they have an issue, your fellow worker, sometimes you have to disregard what could come across as negative, and caring is, you know, really caring for the person. The person
is people going over and above and taking time out to check in on their colleagues.
G'day, I'm Colin. Kindness in my position means that I look at people who come in here with issues, work with them on it, understand what their issues are. Even though, you know, my job is in food service, it's important to me that every morning, everyone in my dining room, that by the end of breakfast, has a smile on their face. It gives them the sense that they're going to be looked after and looked after very, very well.
Kindness for me is where people take that extra step to really show an interest in someone, to show them that they care and to understand their story. Well, you know, once you understand their story, you can strike up an interest with someone and generally you can get along better and get better outcomes.
Kindness is the most important virtue, I think, and Bass Coast Health, kindness is so strongly linked to caring for people. You know, we have staff, volunteers, and so many people walk through this organisation and are kind. They stop, they listen to people, and they help people in need. And so for me, being kind is everything we stand for at Bass Coast Health.